Hi everyone, welcome back to my anal condition series. My name's Catherine, I'm a colorectal surgeon based in Bristol, and here I am at the McCarthy Clinic HQ. Today's video is going to be on how to open your bowels effectively, how to do a poo. Now you may think that this doesn't need to be spelled out. This is something we do without thinking about it. It's something we learn when we're potty trained between the ages of 2 to 3, and it becomes part of our sort of subconscious. It's really not something that you need to give any thought to until you have a problem, that is. So some of the conditions that I treat frequently in my clinic are exceptionally painful and bothersome. And once you have one of these conditions, they can really ruin your quality of life, impact on your ability to do your job, alter your holiday plans, and can certainly make you very miserable. Conditions like anal fissures and hemorrhoids, skin tags, very difficult to deal with. So I'd like to do this video today to talk about the 5 really important points to remember when doing a poo. The first point to say is that it starts with what you put into your body. So you don't need me to talk to you about a healthy, high fibre diet. It's all the rage. The microbiome, eat all the colours of the rainbow, try and adopt a vegetarian diet. But the very bottom line, excuse the pun, is that things like alcohol and ultra-processed food are going to cause a knock-on effect on your bowel function. I think we all know that. So if we assume that we all know that the defecation process starts with a healthy diet, we can then move on to point number 2. Point number 2 is when you have the call to stall, it's important to try and obey it. I do see patients who have toilet anxiety, so don't want to use a public toilet, and rightly so. When we go to school, the toilets are not nice places to be sometimes. It can be embarrassing. If we don't have a toilet that has a fully enclosed floor-to-ceiling door, then noises can be overheard. Friends can make comment on how long we're spending in the toilet. And if we don't effectively open our bowels in that go, then you might need to go back to the loo, and that can lead to sort of disturbed bowel function. So if we put off opening our bowels, let's say we're at school or at work for 6, 7, 8 hours and the call comes, we've all got healthy sphincters, hopefully, and can squeeze the anus, and so that stool that's waiting to come out can be pushed back up into the rectum. And what that means is you can defer the need to go, which we do all the time. However, if we continually defer that, the rectum becomes quite baggy. The gut slows down, the water gets sucked out from the bowel content, and you can have very hard stool. I call it sort of desiccated stool that is then much harder to pass and may lead to straining. And that may mean that you suddenly end up with a painful anal condition like a fissure or hemorrhoids. So if we pay attention to when we get the call, it would be really nice to know that we had it first thing in the morning after we've had our hot drink. However, for people who don't obey that call, it can become dysregulated and it become less frequent, and we don't know when that may happen. So it's really important to spend time paying attention to your body and knowing when the time is right to try and find a toilet and see if you can overcome that toilet anxiety of I might be heard, I may spend a long time here, it may take me time to get clean, and more about that later. But on to our third point is what actually happens when we're on the toilet. Now, some of us may know that the Western toilet, the 90-degree angle, is actually a complete disaster for us to open our bowels. If you look at the way animals open their bowels, usually the squatting position is the best position. The bum goes down, the knees come up, and the reason why this is so beneficial for us as humans too is that in the squatting position, the natural tension in our anus and a muscle that slings around the bottom of the rectum, maintaining our continence, can relax effectively to enable our physiology to open our rectum for us without us needing to strain. If we decide that we need to go to the loo quickly and we've got a meeting and we've got to get on with it, and we get on the toilet in the 90-degree angle and just strain it out without realising, then that is when the trouble can start, because the muscles are still in the tense position. We may need to strain to overcome that pressure. Those muscles are keeping us continent, don't forget. And so the whole process is actually deeply traumatic for the anus, and that is why in Western societies we have a very high prevalence of hemorrhoids and fissures, because we are all unfortunately straining on the toilet without realising. So the only way to adopt the squatting position with our toilet system is to use a footstool, very similar to how we train toddlers to use the loo. So for those of you with small children, I would suggest that you use the footstool as well every time you open your bowels. And when you are there, you need to perch like a bird on the edge with the knees right up by the ears. It's not acceptable to just lift your knees up to your chest and sort of contort yourself, because you will be tensing muscles that we want you to relax. So there is an art form to the defecation process. It does involve time, making sure you know when you need to go, when you go, using a footstool, sitting right on the edge and taking a few deep breaths into the pelvis rather than a desire to force the stool out. And in that way, will you be able to effectively open your bowels in the most gentle manner. The fourth thing to say is, I want you to stop taking your phone into the toilet. If we sit on the toilet in the 90-degree position, we will be pressurizing the hemorrhoidal tissue in our anal canal. The hemorrhoidal tissue is very important because it maintains a watertight seal and it helps with our continence. It's not designed for the pressure, the ring-like pressure that a toilet affords it in the normal sitting position. So if you take your phone into the loo and drag out the toileting process by scrolling on TikTok or any social media, then you will be pressurizing the anorectal ring, and that's where you're more likely to get hemorrhoids. So I want you to leave your phone outside. I want you to focus on the job in hand. And when you're in there, take 2 or 3 deep breaths in the squatting position to aid the process. If you have firm stool, you may need to lubricate the anus with a bit of Vaseline before you go in. And that will encourage the stool to come out without straining. And the 5th point is wiping. Some of us excessively wipe our anus in this desire for hygiene and for cleanliness. Now, if you eat in a nice restaurant and have a napkin, you wouldn't excessively pull the mucosal tissue from your mouth out to get clean. You would dab on your mouth. Now, if you adopt the same approach for your anus, it's important not to keep wiping and wiping, because that tissue, the mucosal lining, like your mouth, can be pulled out very quickly and easily. And once you have traumatized the area, it can pull out and it can bleed and it can cause pain, and it can turn into frilly bits of skin on the outside, which are very bothersome and don't go away on their own. So I would urge you not to do this in future and stick to the 5 points. And you may even want to consider a bidet. It's not common in this country, but in other European countries, I'm aware that people use them. And it is possible to get certain loos installed into your house that have a bidet facility. Thank you.